a not so cozy room with great participants. So I will do whatever I can to make it comfortable for everyone. And I will also give a little bit the lay of the land, what we're going to do in the next 90 minutes. We have 4 distinguished panelists. Each one will be talking for some 5 minutes, going straight, what I would call as a laser focus on different components, different parts of teen pregnancy, child pregnancy. And then I will have some questions to them, and they may have some questions to themselves. And then we will open up the floor for questions, comments, your contributions from the room. So I look forward to a really active 90 minutes. I was asked to remind everyone that there is an evaluation app called Slido, and whatever you like or do not like, use your app at the end of the session and comment on the evaluation of this session. So what we have is, first I'd like to introduce the panelists. We have Dr. Jo Sauvarin. She is Advisor Adolescents and Youth, UNFPA for East Asia Pacific. And Jo will set the scene with an overview of the role of teenage pregnancy as a driver of child marriage globally. Then we have, so that's Jo. Then we have Azra. Azra Cader, Program Manager, Arrow, a regional non-profit women's organization based in Kuala Lumpur, Malaysia. And Azra will talk about teenage pregnancy as a driver of child marriage in the Asia region with a focus on sexual reproductive health. Right next to me is Oriana López Uribe, Executive Director Balance. It's a civil society organization focused on women, young people, sexual reproductive health and rights, Mexico. And Oriana will speak to the particular importance of teenage pregnancy and early child marriage in Latin America and the Caribbean. At the far end is Beatrice Savadye, Director Roots, an organization which promotes economic justice for young people to recognize and realize their personal development and sexual reproductive health and rights, Zimbabwe. Beatrice will talk about empowerment programming as a way of preventing teenage pregnancy in Zimbabwe. So what we would like to do is to really zoom in the next 90 minutes to make sure that we get most out of this session. It's an area in which there are many taboos. There are many parts of the world where there is less space to debate these things. So this is a perfect space, girls, not brides, to talk about sexuality, sexual reproductive health and rights. So Jo, if I can start with you, please be my guest and take the floor.
Thank you very much. Good. Yeah. Good morning, everyone. This presentation is an overview of adolescent pregnancy as a driver of child marriage globally, and it was prepared jointly by UNICEF and UNFPA in the Asia-Pacific region. So in some countries, the pattern of child marriage has shifted markedly in the last decades, moving away from the traditional arranged child marriage. So we need to consider the mix of patterns of child marriage and unions. And in simple terms, these fit broadly into 3 categories with considerable overlap. So firstly, we can see in orange, we have the traditional forced arranged marriage, which is typically non-consensual, where gender inequality restricts girls' agencies. And we all know this type of marriage is arranged by parents, bride kidnapping, etc. Secondly, in green, we have love marriages. And this union, involving adolescent girls, consists of couples who decide on their own to be together, either through a formal marriage, cohabitation, or informal unions. And this type is increasing in many countries. And this trend refutes conventional understandings of child marriage solely as non-consensual or coercing a girl's agency. Adolescent romance, relationships, consensual sex, all take place through these early unions in this category, suggesting that adolescent girls may be exercising greater agency than is usually understood, albeit in limited and often limited social cultural parameters. And thirdly, we have circumstantial child marriage, which will be the focus of this presentation, which can be a subset of the two we've just spoken of. Girls may choose to marry, or very often their parents insist upon it because they have become pregnant or are even just perceived to be in a sexual relationship. And their non-marital pregnancy would break the norms related to girls' virginity and childbearing before marriage. Adolescent girls may marry to avoid stigma and shame. So we'll focus on this category of circumstantial child marriage following premarital sexual activity and adolescent pregnancy, which we will see is a significant proportion of all child marriage globally. So adolescent girls' sexuality is a reality that we have to deal with. In most countries, or in the countries where we have the data, and that's not all countries, adolescent girls' first sex is more likely to be before marriage, as we can see in blue, than within marriage, as we see in orange, in the majority of countries where we actually have the data. And this data comes from demographic health surveys, where typically premarital sexual activity is underreported. And as a result of adolescent girls' sexual activity, premarital conception is occurring, and we can see it's Africa, Latin America, Europe and Asia. And on average, nearly 1 in 5 adolescent girls' first births were actually conceived before marriage, even though the birth may have occurred within marriage. And it varies in some countries to over 1 in 3. However, we'll see in the next case study, which is in Indonesia, but this data is covering adolescent girls, so up to the age of 19. But if we look in a case study in Indonesia, we will see that perhaps for girls under 18, the rates of premarital conception are even higher. So if we look at Indonesia, a neighbour here, this is a conservative Islamic country which reports very low levels of premarital sexual activity, less than 1% in girls. However, premarital conception for girls under 17 is calculated at 28%, so over 1 in 4 child marriages are likely to be a consequence of adolescent pregnancy, even in a conservative country such as Indonesia. So we need much more qualitative and quantitative data to understand the interrelated factors and drivers, but particularly for the pathways starting with sexual intercourse leading to adolescent pregnancy and to quick or rapid early marriages or unions. At the heart of the issue is girls' agency, but also adolescents' biological readiness for sex, which is also important. Superimposed on this is social cultural pressures, but also gender and power inequality leading to forced sex and forced marriage. But if we want to intervene in the pattern of pregnancy driving child marriage, our interventions must be tailored to the needs of sexually active unmarried adolescents. While we have proven interventions for traditional arranged marriage, we have not been successfully addressing pregnancy-driving child marriages. There are common interventions for all types of child marriages, as we will see in yellow in the middle. These are adolescent girls' empowerment, gender norm change, and quality schooling for girls, as we saw yesterday is most important. However, to support adolescent girls who are at risk of adolescent pregnancy leading to child marriage, we need to focus on comprehensive sexuality education and access to contraception through youth-friendly services, and perhaps focus less on preventing the resulting child marriage itself. Adolescents need a supportive legal environment which firstly enables them to independently access sexual and reproductive health services regardless of age, and secondly, does not criminalise consensual sex between peers. Importantly, this needs to be in a legal and social cultural environment which fully addresses gender-based violence and sexual abuse. Finally, a more positive approach to adolescent sexuality, where communities acknowledge the needs of sexually active adolescents and involves adolescents themselves in the solutions, is required if we are even going to start to reduce circumstantial child marriage. Thank you.
Really wonderful insights, and thank you for your presentation. Azra, for you the next one.
Thank you, and we are very happy to be here today. I'll start off.
The presentation of Arrow. I don't know who is managing the PowerPoint. Yeah.
Okay. Yes, I'll start off with a quick introduction of who we are. We are based in Kuala Lumpur, so we're based here. We are an organization that started working in 1993 to focus on improving resources and evidence and advocacy around sexual reproductive health and rights in the Asia-Pacific region. And we do that through a number of means in terms of generating evidence and improving communications and information around it, as well as advocacy through partnerships. And we work very closely with national partners across 17 countries. So I wanted to, my presentation will really focus on why it's important to factor in sexual reproductive health and rights in relation to talking about this issue, as well as elaborate on some of the drivers that are potentially stimulating and driving child marriage in relation to teenage pregnancy. As well as talk about some other drivers that are more broad-based in relation to sexual reproductive health and rights that could be influencing this. So what is it that we mean when we talk about sexual reproductive health and rights? It's a term that, a term that we use a lot, but in relation to what we actually mean and what actually gets focused on is really important. We need to factor these rights in as not a set of secondary rights, but rights that are non-negotiable when it comes to girls, and needed very much in relation to addressing issues of gender equality, issues of individual autonomy, and also in relation to addressing the barriers of child marriage, including teenage pregnancy. And I think it's important to also understand that when we talk about SRHR, we are talking about really something that is a cause and consequence of child marriage as well, in terms of the inability of girls to have choice and use their agency in order to counter and avoid marriage, but also once they're in a situation of marriage, the lack of SRHR then further perpetuates and limits their well-being. It is also very much integrated into and very much integral and embedded in the right to health, and any conversations around the right to health, which talk about the determinants in terms of what do we mean by having a healthy life, which moves beyond having access to safe water, sanitation, etc., but also being able to access SRHR. It talks about, it is within a set of entitlements in terms of the highest attainable standards of health, and SRHR are very much integral in this aspect. So I just wanted to introduce that in terms of trying to frame the whole conversation around teenage pregnancy, as well as how it influences child marriage and the lack of SRHR within this context, or limited SRHR. So I was asked to focus on Asia, South Asia, and Southeast Asia. So this really looks at, which was also presented a little bit in the earlier presentation, looks at adolescent fertility. And numbers are quite high in terms of particular countries driving the numbers up. So in South Asia, we're looking at largely at Bangladesh, Afghanistan, and at Nepal. And in South Asia, we're looking at Philippines, Cambodia, and Indonesia as largely countries that are pushing forward the numbers. But what we know is girls who are getting pregnant. But we don't necessarily have enough information, as was mentioned earlier, about what is driving these. So there's really a need to see how teenage pregnancies are actually affecting child marriage and driving those numbers up. So the interconnectedness and data gaps around the interconnectedness is what is lacking. Okay. So I just wanted to touch on and get into some of the drivers. There are clearly well-known direct drivers that influence teenage pregnancy and lead to child marriage. Those are drivers around premarital sexual activity, stigma and shame, not just in relation to the girl, but also in relation to protecting families from stigma and shame. Around premarital sex and around getting pregnant while having premarital sex. It is also taking place, as Joe mentioned, in the context of arranged marriage, in context of trying to prevent further stigma once a girl falls pregnant, both for the family. It is also taking place within context of non-consent. And it's also taking place in the context of enabling legal context, and here context around disparities in terms of age of marriage, differences in age of marriage, age of consent, etc., are creating enabling environments to push teenage pregnancy towards child marriage. There are, of course, other related factors which we all know very well about around the value of girls, respect towards girls, as well as context around gender roles and norms that further serve to perpetuate these trends. And of course, issues of poverty, issues of we are in the Asia Pacific region. It's a very diverse context, and all of these diversities do affect how the practice is driven, and also how teenage pregnancy takes place and the consequences around it. So I want to hone in on the lack of SRHR in relation to focusing on what drives choices around continuing and preventing a pregnancy. So this is set within the context of limited access to SRHR, which then drives can act as a driver in the context of teenage pregnancy. And here we're also looking at spaces in which girls are not able to control their own fertility, they're not able to access and avoid pregnancies, but also deal with unwanted pregnancies. So the lack and restrictive environments around the right to safe abortion, as well the lack of rights around contraception needs to be taken into account as part of this conversation, I think. So these are some figures around contraception, and to highlight the lack of the limited unmet need in relation to contraception more specifically, and also to draw your attention to some barriers around contraception that young people face in general that also impact teenage pregnancies. And these barriers are largely around cost and access in terms of supply barriers, as well as attitudinal barriers, and in relation to the lack of knowledge. I just want to focus on a few things here. In terms of cost and access to contraception, it's largely around the lack or limited quality of adolescent-friendly services, as well as the focus on the availability of contraception, for instance, within the realm of marriage or being married. So services are available largely to those who are married, if at all, but not necessarily to young people. So this also adds to the barriers. Attitudinal barriers around sociocultural values and norms, as well as attitudes of others that influence girls' ability to access contraception, the need for authorization, and the lack of emergency contraception. In terms of lack of knowledge, also to draw your attention to the need for comprehensive sexuality education, but not just in terms of the physical, biological aspects, which again is lacking, but also to make it more rights-based, and to address not just delivery of curricula or development of curricula, but also to address the barriers that are present in relation to the delivery of comprehensive sexuality education. So I think the question is also, can better access actually break the link between teenage pregnancy and child marriage? I'm out of time. This one last slide that I wanted to focus on is in relation to how sociocultural and particularly religion can help promote child marriage in the context of teenage pregnancy, and to reiterate again around issues of reproductive rights. This whole notion that even when a girl falls pregnant, in terms of how religion is used to justify that, and not allow girls to make choices around ending pregnancies, around so all these notions of it being a gift from God, unnatural, so it's unnatural to end a pregnancy, etc., are also further aspects that influence teenage pregnancies and the continuation of it into marriage. Also, that contraception leads to immoral behavior. So even to encourage the use of contraception means we are encouraging immoral behavior, and decisions around girls' bodies are not necessarily their own. Also, the focus on sex and the differentiation between sex for pleasure as opposed to sex for procreation have all have religious connotations. Just one more minute and I'm done. So I just want to end with the aspects of how this influences sexual rights as well, or in terms of who holds guardianship of girls' bodies and control over their bodies, which is very much not a personal decision, but very much linked to family and family stigma and shame. And throughout their lives, girls are thought to actually protect this in relation to protecting purity and honor of the family. And then also looking at marriage as the ultimate solution in such situations, so that needs to be unpacked as well. And also in the context of violence, even when girls fall pregnant in the context of violence, marriage is seen as that solution. So I'll stop there and then talk about how to address it.
Thank you, Azra. Thanks for sharing the barriers and also interpretations on child pregnancy. So the next person to present is Oriana. She will speak about the particular importance of teenage pregnancy and early child marriage in Latin America and the Caribbean. Oriana, the floor is yours.
Thank you. Yes. Oh, everything has changed. Great. Okay.
The outline is there.
The outline is there, but I'm going to skip it because I don't have enough time. Well, first of all, I need to say that in Latin America, I think adolescent pregnancy it's an issue that it's mainly acknowledged as an issue in the region, and not necessarily early pregnancy though. So I'm just gonna try to build my way there. But then we are the second region with the highest adolescent pregnancy rate in the world after Sub-Saharan Africa. And even though the total fertility rates among women have been decreased, in the adolescent fertility the changes has been very minimal. And in the case of adolescents younger than 15, it actually has been increasing the fertility rate, which is something that we need to be aware of and we need to take urgent action. But it's really hard to do it with all the cultural aspects that we also have in Latin America and that can be similar and very different at the same time. The majority of the countries with the highest rates in Latin America are in Central America with Guatemala, Nicaragua, and Panama. In the Caribbean, the ones with the highest rate is Dominican Republic and Guyana, and in South America, Bolivia and Venezuela. But we know that Brazil and Mexico have the largest numbers, also because we have the largest population. All this data is coming from a report made by the Pan American Health Organization, UNFPA, and UNICEF this year. And there's a lot of differences and nuances that you cannot see because all my presentation is not working. But it's also a guide for me, so I'm just gonna pull out mine while I go. This is not gonna work. Okay, well, the other one, it works. So the main thing is, what do we do with teenage pregnancy that are of people below 15 years old? And this has to do mainly with violence, and there's a lot of violence in the region in general, but sexual violence is one of the main reasons why these young girls are pregnant, and is mainly performed by family members or very close friends of the family, which make us think about all these myths about rape and where it happens, and the sexual abuse where it happens, because we often tell girls that you need to be inside your house with your family, you shouldn't be walking alone, all these things that are actually not working, because what's happening is inside your house you're getting raped when you're very young. And sometimes the only reason why the abuse stops is because the girl gets pregnant, and then people know that she has been abused for all these years and now she's pregnant. So this is something that we need to work harder on, changing all the narrative around rape and violence. But also when they get pregnant, they would be the ones that are most at risk health-wise, physical health-wise. And but we also don't know what's happening, because we know that they were pregnant after, because we're not having enough data around these girls, because we are not collecting data for under 15-year-old women. So we need to also think about that and make it very clear that we need to have access to them in a way that it's respectful of their rights, but also in a way that we can also give them access to sexual and reproductive health and rights, and not just thinking that just by collecting data or by giving them information on sexuality that we're pushing them to having sex. We're actually neglecting them because we're assuming they are not having sex, so they don't have information, they don't have the supplies that they need to prevent the pregnancies that they want to prevent. But also there's this difference between unwanted and unplanned pregnancies, and the context where women live in, and the world vision that they have for themselves. And it's rarely that we ask them why they're pregnant. We always assume that if you're a teenager and you're pregnant, you don't want to be pregnant. But we know that many of them do want to be pregnant. And what do we do with those? Because of course, sexual and reproductive health services are supposed to be there, and they're supposed to be accessible. And also comprehensive sexuality education is for them to have all the tools that they need. But we need structural changes, because culturally they have a lack of autonomy, because we don't see them as adults, we don't ask them what they think, we don't take their decisions into consideration. They are not an important part of the family unless they are pregnant or unless they get married, and then they have that autonomy that they were looking for. And they don't have necessarily options, and when I say options, it can be work-wise, it can be studies, it can be anything that they want to do in life. They already know what they're going to do. If they already know what they're going to do, and one of those things is becoming a mother, then why stopping? Why not just going ahead with that right away? There's a lot of depression also. There's mental health issues that we're not necessarily taking into account. And yes, having a pregnancy might be something that they look forward to, and that they look with hope, and that might give them something that they need to. But also it's a way to get out of a bad situation. They can see pregnancy and they can see marriage as a way to get out of a family that is constantly violent towards them or neglecting them. So it can be a trick in terms of, or a trap in terms that they're not necessarily going to be out of a bad situation at all, but or just getting into another different bad situation. But it can also be a way that they actually get out of a bad situation, and they will gain leverage within the community. Pregnant girls will be supported by their community and by their families to go through their the motherhood, and they will gain a little bit more power and autonomy that they would get if they were just being like in studying, whatever. So my question here is pregnancy a driver to early and forced marriage, or maybe it's not the root? Maybe all the different structural things that I just laid out might be the actual roots of the issue, and then what are we doing? Because in the world that we want, every woman, adolescent girl should be able to decide freely if she wants or not to have children, and the conditions, birth, adoption, doulas, doctor, hospital, in the house. We don't even have those options right now, not even as adults, not in Mexico, but not in most of the countries. We also should be able to decide freely if we don't want to deliver a baby and then have access to contraception and abortion services, and that's still not a reality for everybody. And also, if she wants to have a family, to parent with the support of a social system in a safe and healthy community and without fear of violence from individuals or states, which is also not a reality for most women around the world. And the end is that we should all have the right to live in an enabling environment for healthy and pleasurable sexuality, which we don't. And for that, I just want to end with how do we work around consent and prohibition. And to be able to build around consent, we need to make structural changes and and empower adolescent girls. And prohibition and criminalization creates the false idea of protection, whilst actually criminalizing and putting the people that we are meant to protect, they're going to be the ones that are going to end up in jail or with a fine that they cannot pay, and that we're going to end up vulnerabilizing more the families that we were supposed to be protecting. So that would be.
Thank you, Oriana. Thanks for those frank insights. Now the floor is for Beatrice, and she will be talking about empowerment programs in Zimbabwe.
Thank you very much. So on 10 December 2016, in Zimbabwe, we woke up to the media, a lot of media articles talking about 4,500 pupils, grade 7 pupils, that's the age of 12 to 13, being pregnant in the year of 2016 and being forced to drop out of school because of teenage pregnancy. Everybody was in shock because it's a reality that we had not embraced, that young people are having sex. We were also shocked despite having had 2 years of programming, because we were founded in 2014. We then realized that there's a critical entity that we had been missing in our programming, which is the girls themselves. Because when we started our campaign on ending child marriage, we mostly focused on religious and traditional leaders, on parents, on trying to address policies and laws that allow girls to be married before they reach the age of 18 in our countries. So when after this shocking newspaper article of 4,500 pupils dropping out of school because of teenage pregnancy, we looked inwards and looked at our programming and saw that we had been missing a critical component that is focusing on girls. And we started putting the girls at the center of all our interventions. And what we realized are some of the things that my colleagues already have alluded to is the causes of teenage pregnancy and everything. And one of the key things we also learned is that most of the times the first sexual encounter the girls are going through is coerced. And they sometimes, like my colleagues rightfully said, some of the sex is consensual, but it's young people who are in love. And we did not know how to respond to all that. So when we started putting girls at the center, we learned that they also have limited or no access to sexual and reproductive health information and services that enable them to make informed choices about their sexual and reproductive health. So we started our programming and putting the girls at the center of our interventions in ending child marriage and teenage pregnancy. So I'm going to be talking about our empowerment programs that are meant to prevent teenage pregnancy. So one of the things that we learned from the girls, we heard from my colleagues that some of the girls escape maybe poverty by falling pregnant, and they know if they fall pregnant, they're going to be chased from home. So the marriage becomes an escape from poverty. So one of the key interventions we're doing is economic empowerment for adolescent girls. So in the picture you're seeing is girls that are holding a poster saying "Stop Child Marriage Now." They are involved in farming as a way of income generation within their communities. And we also started a new project recently where we have girls who are producing sanitary towels that are called sassy pads as a way of economically empowering them. We are also promoting access to sexual and reproductive health services and information by teenage girls. Our work is in hard-to-reach areas where maybe the closest clinic is 10 kilometers or more away from the community. So we go to communities. We work with volunteer nurses, like the one in a red skirt and a blue t-shirt is a volunteer nurse. So we go to communities and try and provide one-stop services. We also bring in other partners who provide other services like HIV counseling and testing. We also provide legal aid for when we meet cases of, say, sexual violence. We also do personal development and leadership of teenagers and young women so that they able to create futures that they want for themselves. We promoting their ability to make informed choices, as they also do peer-to-peer mentoring. Like in the first picture on the top, it's a young woman we work with. She's also doing clubs with other young people. So there's that positive peer-to-peer influence, and also trying to address issues of peer pressure in relation to teenage pregnancy. We are also working to create an enabling environment where young people are able to make informed choices about their sexual and reproductive health. We, like in these pictures, I just put two where we are working with men and boys as people who can become agents of social change within communities and address issues of retrogressive societal norms that lead to issues of teenage pregnancy and child marriages in our communities. So that's the brief of my summary and the work that we're doing. And what we have also done is we have tried to address issues at a policy level. We did a groundbreaking constitutional court case in 2016 again, which led to the ban of child marriages in Zimbabwe, because our customary law and marriage act allowed girls to be married before they reach the age of 18. So you would find a lot of pedophiles preying on young girls and escaping jail because they would then offer to marry the girls under the customary law. So that's some of the work we are doing to prevent teenage pregnancy within our communities. Thank you.
Thank you for very meaningfully sharing. Thank you. Your work in Zimbabwe to the first sexual encounter often not having made based on informed decision, and also the being chased from home when pregnant. At times we need these court cases that really provoke a sea change and open new doors and new opportunities for programming. So thanks a lot for that. Now we will start doing a little bit more of a dialogue. And to kick it off, I will ask some questions to the panelists. But of course, after all, most important is that you start now preparing your comments, questions, and suggestions to the panelists. So I give you some time. Think about what it is that you would like to pose towards the panelists. And in the meantime, I would like to ask Beatrice to tell me a bit more about what resistance that you face from community members in your programming, and how do you deal with eventual resistance?
Thank you very much. So I think the major resistance that we face is with the religious groups, the apostolic sect groups, where they don't want you to come into their communities to talk about sexual and reproductive health, or also it's a community where child marriage is very high. So what we've done is we've partnered with organizations. For example, AWET, it's an organization that's an apostolic garment organization. They are also into that kind of religion. So we have partnered with them to go into communities to talk to their fellow apostolic church communities. And some of the resistance that we have faced is you have people who publicly, like even parliamentarians or people in positions of authority will publicly denounce issues of sexual violence, but then in the background, or traditional leaders would denounce publicly issues of child marriage, but in the background, they are themselves doing that and, abusing their authority, and they get away with that. A lot of impunity around those issues. So we have partnered with several organizations that provide legal aid in communities, organizations that are working in, say, white garment churches to talk to those communities.
Thank you, Beatrice. And Oriana, for you. So you mentioned all these frank things that you are aiming for. So what is the role of civil society in tackling this issue of child pregnancy? And how can we engage to the wider community, including men and boys?
Well, I think that one of the main roles of civil society is to build the bridges and fill the gaps. So one of the things is to be able to visualize that there is a lack of information around under 15-year-old girls, and then push for governments to collect that data. But it's also about looking at the reality and being in touch with the communities, being able to bring the needs of adolescent girls to the policy level, and to also push harder for governments to comply with the things that they have agreed at the regional and the international level, so they can. It's just like building everything together and making a stronger connection with what girls need, and then what the government has agreed, and then how do you connect those two and make it happen. And I think that's one of the roles of civil society. But one other thing that, and it also has to do with how to engage men and boys, is how do we make a transformation of the gender norms and the social norms, and how do we make sure that when we are implementing policies, we are not repeating the same model, the same patriarchal model, the same heterocentrist model, and that we're actually challenging those gender norms that are putting girls under boys, and that we're actually investing in putting the things on the hands of women and girls, instead of just saying we're gonna invest on, let's say, masculinity, or like these kind of things. Like that's one way to work, but not without working for the empowerment of girls themselves, and to have them being accessing the things that they need, and the CSE, but also the contraception that they need, and also having structural changes that will bring opportunities and different options for the development that they want from the perspective that they have to women and girls.
Thank you, Oriana. So are you getting ready? I have a few more questions for the panelists, and then I turn to you. So, Azra, what do you feel are the most important elements of a comprehensive prevention strategy?
Okay, before I get to that, I'd just like to add on to, I think in terms of how we look at the problem is also really important, in terms of framing it as a political issue, as an accountability issue, and as a rights-based issue, in terms of gathering political will around it to change. It's not just an issue that happens in homes. It's not just an issue that is faced by girls in an ad hoc manner. It needs to be framed as a rights-based issue for young people, to be able to make an entry point in terms of addressing it, I think. So I think a comprehensive approach to looking at that needs to bring those elements in. And I think we also need to bring in and look at the lived realities of young people, young girls particularly, in terms of what are the issues that they're facing, in terms of how are they experiencing it, in terms of contextual aspects that really affect their access and create barriers to access. And then zoning in on really having easy to access comprehensive sexual reproductive health services that are non-judgmental, that are not costly, available to young people in a manner that they can access it. And of course, making the point again about comprehensive sexuality education, any comprehensive solution or prevention strategy should be a right space, but coming in from engaging on issues of comprehensive sexuality education, but also trying to meet those who are out of schools and trying to bring in and influence and target those who are out of school so that it is a broader strategy of prevention.
Thanks. And Joy, you were waiting, I'm sure. Is she still turning back to me? Yes, I am. So can you tell us more about empowerment and child protection strategies in the context of child marriage and child pregnancy?
Yes, yeah. Or even I might go back further, just talking about the data, and then I'll come to that.
Yeah.
Because I think the numbers are political. We have SDG 5.3, and so we get for each country one number for child marriage. And I think we need to unpack that number before we can program effectively, because behind that number we have the pattern of child marriages. We have forced and arranged child marriages. We have love marriages. We have cohabitation of young people choosing to be together. And we have the circumstantial child marriages. So we need to understand what is happening in each country. And it's not one national figure. We have to know geographically and between ethnic groups, because it's different in different countries and between different groups. And to understand that, we have the quantitative number, but we also need to have the qualitative data to understand the how and the why and the decision making behind this. So, and that's we need to know about the more sensitive areas, such as the premarital sexual activity and the premarital conceptions. We need to understand the data between the context of the first sex, whether consensual or not, and the decision making, the gender relationships of the young people, and the contraceptive use. And then if we're talking about the circumstantial child marriage, we need to understand the factors that were involved in the family and the community and the young couple's decision to get married or not. So there's a lot of data and understanding behind that. And getting on to the empowerment versus protection, I think when we're talking about legislation that is trying to be protective, I think it's very clear about that legislation against legal child marriage is clear. But I think if we're talking about adolescents' sexual activity, the reality is that adolescents are sexually active anyway, despite whatever laws we put in place. And so we need to make sure that our laws enable young people to have safe, consensual sex, rather than criminalising sexually active young people.
I was going to write it down because I thought it was an important sentence on legislation for young people to have safe and consensual sex, but I didn't finish writing. Okay, now I turn to the audience. So let's start right up there. There is a microphone, yes, it's in the middle of the room on my right-hand side. Can you please introduce yourself, and then your comment is welcome.
Yeah, I'm Farhana Yasmin Hassan from Bangladesh. I work for TEDxom Netherlands, and I'm a project director of a project which is called Initiatives for Married Adolescent Girls Empowerment, who were married before the age of 18. And we work for 9,000 early married girls and supporting there in the context of SRHR. What we have found in the community level, we also work with the 9,000 girls, husbands as well, spouse and mother-in-law. What we came to know from the discussions with the spouse is that they were not also aware or had knowledge about pregnancy, about contraceptives. We were very surprised to learn that many of them didn't know about condoms, male system, because it is perceived that birth control is completely women's or girls' or wives' responsibility. So I think this is a very important point where we can include spouses. The knowledge of spouses is very important, and adolescents as well. That is one point. Secondly, if in our 9,000 early married girls, we have found the average age of marriage was 14 and average age of first child was 15.5, close to. And once they're being married or unmarried, once pregnant, what is the next? Is there a safe abortion process? In Bangladesh, it's not possible. Only option is to get married off, or very unsafe abortion. That is one very high risk thing. Second thing is antenatal care and postnatal care. These are not at all, especially postnatal care is not at all in practice. So for adolescents, these are very, very important things. If not possible for safe abortion, if not possible for any abortion, then antenatal care and postnatal care for the adolescents should be ensured. Thank you.
Thank you so much. Any question to a panelist, or that was sharing your experience? I'd like to ask Arrow, because from this area, what would be your suggestion to cover these two things in the context of adolescents? And another point I'd like to add, there is adolescent health-friendly corners developed, established by the government, but adolescents do not go there for contraceptives. They only go for menstrual problems only. So this is another point I'd like to add. What could be the options? What could be the solutions for this? Thank you so much. Azra?
Okay, thanks for your question. I mean, I think with Bangladesh, it really presents an interesting case in relation to access to safe abortion services, particularly. Because despite the criminalization of it, the avenues are open in terms of women being able to access menstrual regulation. And that actually provides an opportunity for women to access safe abortion services from the perspective of menstrual regulation. That does have its barriers in terms of access, in terms of knowledge about it, in terms of service providers, etc. But it does provide a little bit more of an opportunity to, in situations where girls are looking to terminate pregnancies, to look at that route of service.
Thank you so much. So the next contributor in the middle, not center yet, but yes. The aisle. Thank you. Please introduce yourself and then...
Thank you very much for the presentations. I'm Presi Konde from Uganda. I work with Child Care and Youth Empowerment Foundation, and we try to rehabilitate child mothers and ex-brides. My question is, it goes to Oriana. What would be the importance of us asking the girls about whether they want to become mothers? For example, if I have a 14-year-old girl and she's in school, how important would it be for me to ask her whether she wants to be a mother now or not? For example, she says yes. What would be the next step? And then to her, I didn't get the name. Yes. For us, what we have done, when the religious leaders, for example, the Catholic Church, when they say no to abortions, when they say no to contraceptives, what we do, we work with them. Because the tensions between the church, for example, the big Catholic Church, you cannot fight them and then win them. What we do, we just join them. Because they have this natural family planning. So what we do, we go into them, because the Catholics anyway will listen to them. And what we do, we go into their youth department and work with the church on promoting the natural family planning method that they are promoting. and then try to empower them so that they reach to as many women, as many girls as possible. And even in the Catholic schools, we empower them to teach the girls about the natural family planning method that they are promoting. And then with the mosques, that one is difficult because Muslims don't have this family planning method that they are promoting. This was just information. Thank you very much.
Thank you. Joe, do you want to give it the first shot to comment?
It's not answering directly, but if we're talking about pregnant girls and how to... some girls are planning pregnancy, and I think this is because of limited choices. And in some ways, hopes and dreams are the best sort of contraception, because if you have looking forward to your education or employment or other opportunities, then you will choose not to get pregnant. And at the moment, some girls don't have those hopes and dreams, and so as Oriana was saying, that's the best sort of contraception. And the other, I agree, we have to work with whichever partners are available. And so if some partners are offering one type of contraception, we will work with those. But I think girls deserve the best, most effective methods of contraception available, and so a range of contraceptive options are very important.
Ariana, you also want to comment?
Yes, of course. But it's important that nuance if she's pregnant or not. But because I do think that that's one of the main reasons why we need CSE in schools. And it's because it also gives you the space to actually plan for your life and make space for that, because otherwise you end up learning all these other subjects that are very relevant for a specific way of living. But if you don't have a layout moment where you are just planning and dreaming and then setting your own project for your own life, then you can just tremble into all the lack of options or options that are put in your face. But if you're already pregnant and you have a 14-year-old, I think that it's really important to understand that every 14-year-old is going to be different. And you cannot say cross-cutting that all 14-year-olds understand or not understand what pregnancy means or what motherhood means. And then you need to know which kind of 14-year-old you have in front of you to be able to make sure that she understands and that she is willing to, and then what are the different things that she's going to change in her life to accommodate this in specific. But yeah, you need to respect her decision, and you need to support her to achieve her dreams. That's everybody's work.
Dreams. Any other comment? Yes, right in the middle, in the center, the microphone is coming. And you are coming to the microphone. Yes, good for the sports, yeah.
Hi everybody, my name is Marguerite Hansen. I'm actually a student. I go to Columbia University in New York. My question is kind of like a response to all this. Oh, by the way, thank you for your words. They were very inspiring. My impression is kind of that the pressures of safe sex and unplanned marriages and how to go about them in a safe way and early and unplanned pregnancies, the pressures are kind of put on the women, but the root cause of it all is the patriarchy and the gender inequalities around the world. And I just kind of feel like if the root cause is the patriarchy, then why are the boys not also being educated about what a safe pregnancy is, what safe sex is? Because a lot of the time, if the women are educated and the boys aren't, like, what happens next, you know what I mean? So, and pregnancy is, after all, like, not a women's problem. It's not just a women's thing. So I just want to know what your response to that is.
Yeah, maybe Beatrice on patriarchy and working at community level.
Yeah, thank you very much. And you're raising a critical point. Like you saw in my last slide where I talked about our work with men and boys and trying to address issues of retrogressive masculinities and how men are involved in the whole jigsaw. So we work with men and boys as part of our programming and also looking at them adopting new forms of masculinity and also for them to look at gender equality is the way to go, and also them as protectors, not just perpetrators of sexual violence, but the roles that they can play in terms of ending child marriage, in terms of ensuring that there are no unintended pregnancies happening as a result of their masculinities.
I know that Joe was also interested to comment on this one.
Just that one of our best tools or our solution is comprehensive sexuality education. And there's very good evidence that if gender is a strong focus of your comprehensive sexuality education program, it is 5 times more effective in reducing adolescent pregnancy and HIV. So, and that's because it's the relationship between the boy and the girl that's the important part, and that needs to start at age 5 or even before. So in primary school, this is when our gender norms are developed, and that's when we need to be working with boys and girls.
Just 10 seconds. And if not, if it doesn't have gender, then it's not comprehensive sexuality education. It's just sex education. So that's the comprehensive part that we need to.
Great. There is now a question or a comment in the center of the room. I don't know where the microphone is, and then I turn to you.
I had a question.
Here in the center, I don't know where the microphone is. Oh, okay, go ahead. Sorry, the microphone is hijacked. So.
Actually, I was in line before, but anyway.
No, that's fine. I can't see everyone very clearly, so please go ahead. Most welcome.
Thank you. I just have a question to the entire panel. Thank you so much for your presentation. I'm from a group based in Afghanistan, and the situation that we are facing with is that the majority of these young girls who become pregnant are often forced into marriage to men who are in their 30s and 40s. I just want to see if you have the same situation in your setting when the young girl is either forced or end up in a relationship to a man who is much younger as a pattern in the society. And if so, how do you talk about the agency of the girl when you have this power imbalance, basically? You have age and money, and basically the entire setting is working against you. Thank you.
Tashakor. Azra, do you like to comment on? You were the one also with your last slide on.
That was a comparison.
Yeah.
Okay. I mean, I think that's why it's important to try to prevent these sorts of child marriages from taking place, because it is not an equal playing field. So prevention is one angle, I guess, in terms of trying to address it. But also trying to address the broader systemic issues is really important. Notions of respect for girls and trying to, and women themselves, trying to integrate that into every aspect of programming, every aspect of awareness raising, and trying to deal with it as a systemic issue rather than trying to just address and reduce child marriage numbers, or trying to address the context in which a girl is experiencing child marriage. It needs to be a broader, more comprehensive intervention that looks at addressing systemic issues. Because until we address those systemic issues that are the root causes of why child marriage takes place, right, in all of our regions. So unless we actually address those systemic issues, unless we get rid of patriarchy, unless we get rid of all of these inequalities that girls have to face at the very ground level, then we're not going to be able to address child marriage.
I also like to invite Beatrice, because you're doing a lot of programming.
Thank you very much. So for our country, it's a mix. You have a lot of child marriages that are happening amongst young people, but like you rightfully say, there are also those that are happening with older men, and that's why we did the Constitutional Court case that I alluded to earlier, because we realized that under our customary law was silent on the age of marriage, and our Marriage Act said girls can consent to marriage at the age of 16. So you'd get a lot of older men who sexually abuse girls, then offer to marry them customarily. So the law is one thing that we have worked with to ensure that we don't have such kind of unions happening. And we have also worked with men because there are men who have positive stories to tell, men who married off their girls, whom we are using like positive profiling of men who are becoming champions within our communities, speaking out against child marriage, and also talking to their peers around the need to end child marriage.
So the role of men as champions. So now I'm looking for the microphone so I won't embarrass anyone anymore. So now we go to the center of the room, in the center. Yeah, thank you.
Thank you to our wonderful panelists. I'm Annie Modi from the Democratic Republic of Congo. Thank you, Beatrice. I'll just ask Beatrice to maybe just share more on how are you using the Maputo Protocol, for instance, as the base of your advocacy work to allow girls with unwanted pregnancy to access safe abortion services. And also to others, just how are you really taking into account that aspect of girls with unwanted pregnancy? Because we know when they want a pregnancy, they don't want a pregnancy, they will find a way to get rid of it anyway. So how are we putting that question of unsafe abortion into our work of eradicating child marriage? Thank you.
Thank you very much, Annie, for your question. So as Roots, we are in a platform that's called Right Here, Right Now in Zimbabwe, and some of the work that we're doing around safe abortion is bringing the evidence where I think in Zimbabwe we have 700,000 abortions, unsafe abortions that happen every year, and bringing that evidence to policymakers. In that coalition, we have done community dialogues to understand why unsafe abortions are happening and what communities feel should be done, because our Termination of Pregnancy Act allows for for abortion to happen, but under restricted conditions. And girls who are pregnant, in the cases where they are not, say, raped in those love unions that we talked about, do not fall in the category of people who can access safe abortion. So we have also done tribunals where we take policymakers to communities and have people doing like a tribunal for policymakers to understand the impact of unsafe abortions happening in the community. And at this stage, we are going to be petitioning our Parliamentary Portfolio Committee on Justice to do public hearings around issues of unsafe abortion. It's just that we're having elections in the coming month, but it's something that it's in the pipeline in our plans to address issues of unsafe abortion. And one of the things that we're also even finding in communities is that we need to provide abortion on demand. And also for girls who are under the age of 18, is some of the solutions coming from the communities that if girls fall pregnant and they're under the age of 18 and they want to have access to safe abortion, it should be allowed and should be accessed for free.
Thanks a lot. So we go now to this part of the room, the woman with the yellowish dress. Yes, please.
Merci, je ne suis pas anglophone, donc je vais parler en français.
Oui, très bien.
Ma première préoccupation, c'est que moi, je suis venue dans cette session par rapport au thème que j'ai trouvé très intéressant parce que je mène au Togo un projet sur la santé reproductive des jeunes. Maintenant, est-ce qu'il y a un moyen de pouvoir capitaliser tout ce qui a été dit en anglais et qui n'est pas rentré dans mes oreilles sûrement parce que je n'ai pas compris ce qui est dit? Est-ce qu'on pourra trouver ce que les panélistes ont dit sur un site? Je ne sais pas, mais comme on est entre anglophones et francophones, je me dis qu'il y a peut-être moyen de pouvoir partager ou avoir accès à tout ce qui est dit. Maintenant, ce que moi je voulais partager dans cette session, c'est que dans le projet que j'exécute dans 10 collèges au Togo, après une année, dans l'un des collèges, il y a 10 filles qui étaient enceintes quand même. Et parfois, des filles du même banc. Donc, j'ai compris que c'est vrai qu'on fait de la paire éducation. C'est des jeunes qui parlent à d'autres jeunes et qui sont vraiment censés de comprendre. Mais les filles ont d'autres mentalités. La conclusion à laquelle je me suis rendue, ou ce que j'ai conclu, c'est que c'est beaucoup plus à la mentalité des filles qu'il faut s'attaquer. Parce que des filles tombent enceintes et elles trouvent que c'est des ballons d'or. Dans cette condition, comment pouvoir les amener à comprendre que non, tomber enceinte, ça veut dire que je vais plus loin, je vais pas réussir ma vie et tout. Si d'autres ont des expériences, ils pourront donc partager avec nous. Merci.
Merci. So, who had the translation? I didn't bring my headphone, so...
Okay, so I'm gonna be
yeah.
the one that's gonna answer, just because I had that translation. But I don't know if you understand me. Yes? ¿Le doy el mío? Okay. I was going to speak in Spanish, just to mix it up a little bit more. I think that, if I understood correctly, the question was how do we make sure that girls are not romanticizing the idea of being pregnant and thinking that it's great, and how do we make it real, and that they see the challenge that it's going to imply for their lives to be pregnant. And I think that has to do with how do we break all the narrative around pregnancy as something that it's always experienced with a happy environment and with a lot of support, because that's not necessarily the case. But also, how do we make sure that governments, from my point of view, make sure that if you're pregnant, you still have access to education, to work, to other things, so that you... So it's both sides. We need to change the narrative, and we need to make sure that women, when they experience violence, have the option to have abortions, but also that we don't romanticize motherhood in general, because that's not good for any women of any age. But at the same time, how do we make sure that governments are having like a proper social system that's supporting women, whatever they decide? And that has to do with one of my slides on sexual and reproductive justice. How do we make sure that there's a system that will support you, that it doesn't mean that if you're pregnant and you decide to have a family, that is not then led for you to not be whatever you want to become other than being a mother. So if you want to be like a lawyer and you want to be a mother, you can do both. So I think that it's a comprehensive and a more holistic approach that we need to take in terms of sexual and reproductive justice, and that has to do with having the whole information out there and also the support system that we need.
Thank you. This is that's a dialogue that makes sense for you.
I can also do it in Spanish.
Okay. We have a colleague here in the middle of the first row.
She's going to speak French too.
Okay. Is it morning or afternoon? I want to make sure of the time. Good morning to everybody. My name is Marcia F. Kane, and I come from Liberia, representing Basket of Hope and CSO Alliance. I have a compound complex question for all the panelists. I think Beatrice mentioned something about a community that I heavily embedded with tradition, and I found myself to be coming from one of those areas. my question specifically is that, what do you do as an institution where, in a community where there is high illiteracy rate, poverty rate, like in Liberia, an average Liberian live on $1 per day. It has high illiteracy rate also and poverty rate. So as an institution, how do you approach parents to let them know that their children, girls' children, are not supposed to marry below ages of 18 or below age of 18, sorry. How do you do that? And then an institution that is now also capacitated, that is now empowered, how do you address those issues, those complexity that you're faced with? I'm talking to everybody here.
Thank you very much for, that's the bottom line. How do we work in communities that are most challenging when it comes to this? Beatrice, I will start with you.
Thank you very much. And I think the communities that we work with, like if you saw from the pictures, they are not urban-centered. So I relate to what you're talking about. As an organization, we also don't have a lot of resources, but I think what's key is making sure that girls have alternatives. Because in most communities that we work with, also responding to her question around young girls romanticizing the idea of falling pregnant and becoming mothers, sometimes it's because it's the only reality that the girls are alive to. Everybody in their community is doing almost the same thing and they don't have other alternatives. So to respond to you, there's no one-size-fits-all kind of approach, but what we have seen to work within our communities is making sure that we are collaborating with a lot of partners. For example, we go to a community, most of our work is around demand creation for services like sexual and reproductive health. We do not have money to be funding, say, girls to go to school, but we go to communities with organizations such as World Education. So when we go to communities and communities are now aware about the consequences of child marriages, and they're saying, oh, okay, now we know, but we're not going to, that we shouldn't be marrying our girls off, but we don't have money to send them to school. We then refer through our gender-based violence desks that are within communities, such kind of girls to, say, World Education for their educational scholarships. And we also come in with a component of economic empowerment, like with the pairs that I talked about, with the farming that I talked about. So what we have seen to work is not going into communities as an individual organization, but collaborating with other partners who are also providing a wide range of services and information, but also keeping our governments accountable, because most of the things like service provision, making sure girls are going to school, is the role of the government at that macro level. Thank you very much.
Yeah, I mean, I think just to add on to that, alternatives are important, but also attitudinal change and change beyond girls themselves and girls what they believe in is really important. Girls who are within a family context, attitudinal change needs to come from there, because that's where the decisions are made, whether to send girls to school, whether they're better off working somewhere, like real practical solutions in terms of how to address those barriers is what can actually affect change, and giving girls the alternative is one, but I feel attitudinal change is another.
Joe, the question also was about how do you approach parents? Any thoughts on that? To avoid marriage under 18, child marriage and child pregnancy.
I think there are very good programs, particularly working with parents on traditional and arranged child marriage. I think we're still learning and we still need a lot more investment in programs that work with parents about adolescent sexuality, which is driving both the circumstantial child marriages, but is also driving love marriages, and is also a fear of parents that is driving traditional and arranged marriages. So I think we've got a lot of work to do on the adolescent sexuality.
Oriana, as the speaker was asking for a comment of each one of the panelists, you can enjoy that moment too.
I will say that just to give something from my context, I think one of the things that we struggle the most in Latin America is that there's a lot of pushback from parents on sexuality education and services based on religious beliefs, on mainly Catholic or Christian beliefs. And I think that the role of schools and the role of government, since we are not in Latin America, most of our countries, although some are still linked with the church, not all of them, not the majority. So we have a balance in between what is in the law and what you need to give in schools, and that can be without religious values and based from scientific, secular information. So that's a good way to balance what parents, when parents want to limit the information or the services that children get, because it's not only the responsibility of minors falls into all of us too, not only into parents.
All right, so we are not yet finished, but we are getting to the end. So I take one or two more questions and then we will wrap up. Please go ahead.
Thank you. Mine is not a question, but a comment.
Can you introduce yourself also?
Okay, my name is Busisiwe Marunda. I work for REPS Zimbabwe. I'm the REPS Zimbabwe country director. Thank you, ladies. My comment is in response to what the lady there raised. I think we can talk about policy change, we can talk about legislation around child marriage. But we need to get into a space where we can get our governments to present real opportunities and a real chance for a rural girl to get into a classroom and have access to quality education and be able to realistically dream of something else besides getting married. As long as we keep telling parents about not marrying off their children, and their children are going to school, and when they get there, they don't see an opportunity, we will not be able to end child marriage. We will not be able to achieve social behavior change at a personal level. So I think we need to be knocking at the doors of our governments so that our rural girls get the same opportunity that children of affluent people are getting when they get into the classroom. Thank you.
Thank you so much. I take one more, and in the middle again, more or less the fourth row. Two, okay. But first this one, the woman there. And then we take the two at the same time. I turn to the panel and then I'll do the closing remarks. Yes, please.
Bueno, hola, yo voy a hablar en español, perdón. Sí, solo no puedo pensar en inglés.
Tal vez voy a traducir.
Bueno, gracias. Bueno, mi nombre es Gaby, soy asistente de investigación en Population Council, pero tenía una pregunta personal para Oriana, porque, digamos, en nuestros países se supone que el Estado debe ser laico, ¿verdad? Y que las acciones que se tomen en contra del matrimonio infantil deben tener esa perspectiva de laicidad, ¿verdad? Entonces, mi pregunta es si tú conoces o sabes cómo hay o si existen organizaciones que están intentando enfrentar este problema, ¿verdad? De un Estado que debería ser laico y no lo es. Y cómo o qué historias de éxito o fracaso tenemos sobre eso. Gracias.
Muy bien, gracias. So, I will translate. Our colleague is from the Population Council and she would like to hear a little bit more about experiences of organizations of failures and successes. So I will, after we hear the next one, I will pass maybe for you first. So please go ahead.
It's not questions. I wish to share something about the government policies in Tamil Nadu. Actually, my name is Dr. Radha Damodaram. I'm coming from Tamil Nadu, India. I'm working with HEALS NGO. I'm president of HEALS NGO, which is working 23 years back. So actually, our organization is working all over the states, all over the districts of Tamil Nadu, with the help of 320 networking NGOs. So here I wish to tell one thing about the government policies in Tamil Nadu. Actually, through the HEALS, through our NGO, we are giving awareness programs in 12th standard to the students about sexual and reproductive health. And we are also conducting meetings for the parents, teachers, boys separately. And then we are giving awareness about all these things. Whatever we are discussing, the problems, all these things we are giving the awareness program. And also primary healthcare centers in the villages, they are giving special care to the teenage pregnancy girls, and safe abortion methodologies also they are following. And maternal health, once the government is accepting the pregnancy case, they have to, the parents has to submit the registration certificate, marriage registration certificate, so that they can find what is the age of the girl. So most of the cases they are putting that if even it is a teenage pregnancy, the age has been given like 19 or 20, but even though if he is finding it is a teenage pregnancy, they are giving special care to the child in the hospitals. So somewhat, for example, out of 100%, 72% girls are not accepting to have pregnancy. They are going to the abortion only. Only 3.8% only they are interested to have the child. So if both the cases we are taking care. So by giving the awareness to the parents, boys and girls at the school level, 11th and 12th standard. So somewhat we are able to give the information about safe abortion and care after the pregnancy, and also using condoms and everything. So this is I wish to share. So this is happening in Tamil Nadu.
Yeah, thank you for sharing that experience, positive experience of Tamil Nadu. So on the successes and failures, maybe Oriana first.
It was successes and failures for the secular state, and I think that it has different levels in Latin America, so it depends on the country that you're talking. I think Argentina or Mexico can be different from Guatemala or Honduras or the other countries. So one of the things is that, as Chandra said yesterday, we need to be watchdogs, and I think that's one of the roles of civil society, is to keep maintaining the government secular, the most secular that we can. I know that Opus Dei is really strong, and it has a strong link with the government and with people in power taking on the stakeholders. But it's something that we need to keep doing, and I think in the region we also have Catholics for the Right to Decide, and it's a network that's specifically working around how to be Catholic, but also asking for secular state at the same time. And I think that it's an important network to link with at the national level. And I don't think that they have it in Guatemala, but it's an option that we have, and we have in Latin America an initiative that's called Mira que te miro, which is like looking at the Montevideo Consensus. And one of the things that we decided to do is mapping out, monitor the laicidad, the secularity aspect, and even though it's not part of the Montevideo Consensus, it's something that we're mapping out for the different countries. So it's a good tool that you can use for Latin America.
Thank you. So before the room gets empty, I like to give everyone, every panelist, to do a few seconds and to give the audience one takeaway. So that takeaway, whether it's on data, whether it's on not one size fits all, whatever you want. So think about a takeaway, and for me, I will start. I have asked everyone to introduce themselves by name, but I didn't introduce myself. So I'm Karin Hulshof. I'm the UNICEF Regional Director for East Asia and Pacific. And my takeaway is to understand really that if we talk about child pregnancy, teenage pregnancy, that is a driver for child marriage. And the way to go about that country by country will differ. There may not be one size fits all. And the role of adolescents in finding the right key to work on the topic of teen pregnancies, child pregnancies, is to be discovered country by country, and we can learn more if we have more data available. So that's my takeaway, and I will pass to Oriana, then Joe, then Azra, and then Beatrice.
Well, I would say that Latin America is struggling with the idea of actually seeing the problem that we have on early and forced marriage, and I think that it's important for everyone to start looking to the reports that are coming out from Latin America on the issue on early and forced marriage, but also the things that we already have on teenage pregnancy, because that is the issue that we have studied for longer and that we already acknowledge, and then how can we bridge them together. And the takeaway would be that we need to dismantle all the models that are coming from the patriarchy. So maybe we need to end marriage, not only teenage marriage, but just to dismantle the whole idea and conception that we have on motherhood, on abortion, on marriage itself.
Firstly, just one failure in response to the earlier question is that in East and Southeast Asia, we have many countries where adolescent pregnancy is still increasing, similar to Latin America. So we have an enormous failure that we're not addressing. The issues, takeaways, data, we don't know. If we don't know what's happening, we can't respond to it. We need a nuanced approach, not one size fits all, as Karin mentioned. We can't put our heads in the sand and ignore adolescent sexuality. It's happening, we need to respond to it. And we need to make sure our laws enable that. If a responsible adolescent is brave enough to go to a clinic to request a contraception, they should not be turned away and they should be welcomed, and they should not be criminalised for being sexually active.
Okay, I think for me, it's really important to have resources, to be able to use these resources to prioritize sexual reproductive health and rights in the region. I think that the other point or the other takeaway is not to look at girls as reproductive machines, not to look at them as the ultimate goal in life is to reproduce, but to give them opportunities and alternatives so that they can move away from concepts of having to get married, so that they can dream and aspire and things like that. On the issue of religion, I think that's a really critical aspect to consider in relation to sexual reproductive health and rights, in relation to addressing child marriage. Because it is really a barrier in our region. It is really preventing girls from accessing their rights and approaching the issue as needing to engage religious leaders. I think is really limiting, because it takes away from agency of girls. It takes away the need to empower girls, not just in terms of how they understand their rights and how they're able to access rights, but also how they're able to question narratives around religion that limit their rights. So it's also then the need to develop progressive narratives around religion that can help girls access these rights, and to not separate religion and rights in that conversation, but to see how they can actually be seen together, and how rights can be realized, if necessary, within a religious framework.
Beatrice, the last word is yours.
Thank you very much. The first is to the donor community to continue or to increase funding for community-based organizations who are frontline responders to issues of sexual violence that are happening to adolescent girls, and also generally to everybody who's doing work to prevent teenage pregnancy and child marriage, to say, let's continue to be alive with the reality that adolescent girls are not a homogeneous group. Let's put girls at the center of all our interventions so that we learn from them and they are part of designing the solutions to the challenges that they are facing. Thank you.
Thank you. Thank you all, panelists. And now it's time for lunch. Okay, enjoy your lunch. See you after the lunch.